So this is the
Mm,
first question that we have.
yeah. Well, I think if you're a newer clinician and your treatment planning isn't going the way you anticipated, um, I mean, there's a few things you can do, right? You can consult with people to get second opinions, but of course, you have to challenge your own anxiety and shame to be able to do that and recognize that, hey, I'm going wrong somewhere. It might be that it just takes a bit more time to develop discernment around how to distinguish um, symptoms between
Okay.
disorders or between problems, right? We have this in mental health as well, where everything just looks like anxiety, on the first level. People don't say, "Oh, immediately you have PTSD," or "Oh, you
PTSD,
have
right?
an avoidant personality," or I think this is a
You are
delusional.
narcissist.
Yeah, yeah, exactly. We start with okay, some anxiety. Oh, okay, right. So I think giving yourself space for curiosity is important. Um, Now, mental health is a bit different than physical health because we don't do, we're not doing blood tests, but in this sense, we're looking at criteria and then creating a plan, right? And so I think consultation, giving yourself time to practice, building discernment, giving yourself the space to grow can be very important. Um, it might also be, I've seen with newer clinicians in psychotherapy, they find a couple of things that works and they get really excited. They're like, I used this worksheet or this tool to help somebody with anxiety or with something,
Okay.
but then they try to use it with different people and it doesn't necessarily work. And so for
All right.
me, there is, well, you need a bit more information about the person's context and their life before you go in with the tool. So it might be a consideration for a more thorough assessment.
All
But
right.
now I'm speaking from a different field, so take from that what you think is useful.
Okay. All right. Okay. So you have to be consider. You have to do consultations. You have to take second opinion, and you need to learn and apply. All right.
Yeah,
So let's
yeah,
yeah. So let's take up the second question: how to ignore the unwanted things in a day-to-day life?
yeah.
Distraction.
You know, yes, that's really interesting because when I read that, I'm thinking, are you talking about productivity tools? Because that's what people often will say, like, I'm getting distracted by many things, um, and it's taking up emotional energy. So you might think, okay, how do I structure my day so that I can optimize my productivity? Or do I block certain applications on my phone so those don't suck up my time? I think another way to interpret distractions is like um, things that don't go well,
Okay.
uh, not for them to take up too much time, right? And so, one thing you can ask yourself is, can I control this? If so,
Mm-hmm.
I'll keep thinking about what to do. If I can't control it, I'll think about it later, or maybe I'll let it go for now. You
Oh,
know,
okay.
so that can be a way to, like, if you're looking for a quick algorithm, or a flow chart to say, this thing is distracting me. I keep thinking about it. You should ask yourself, like, can I control it? No. Okay. I'll think about it later. It's not that it's not important, right? Things that bother you or take up mental space are important. So if you had a fight with your partner before you left home, or you're worried about how your kids are doing in school, those are valid things. But while you're in your clinic, you can say to yourself, this is important, but it's not urgent. I can't
And
control it right now.
okay.
I'm going to move on. Right.
Okay.
And
All right.
so you're having a little conversation with yourself.
Yeah, you have to stop the letting your brain do the talking every time.
Yeah. Another thing I will say, though, to be fair, is that um, because I supervise a lot of therapists and they'll say to me, this client keeps coming back and they keep saying the same story. And I would say, yes, that must be so annoying for you as the therapist. And they're like, yes. And I said, okay, but there's another kind of meaning they're still trying to extract from that experience. They're
Okay.
still trying to understand something. They're still trying to come to terms with something. So you're not
Mm.
engaging with them in a way that's allowing them to get there. So if it's a fight, maybe they want to hear, "Oh, you felt disrespected. Oh, it's hard for you to accept that you're powerless in the situation."
You have to connect the dots.
Exactly, exactly. So something is missing. So you might even tell yourself, I'm trying to figure out something about this, or I need something more before I can move on, but I'm not going to find it in this moment. And then we move on.
Amazing. Amazing. This reminded me, this we were discussing, you have to move on. Reminds me of one quotation from Marcus Aurelius. You control how you react to the outward stimulus. This thing has stayed with me. It's like embedded in my neurons. You have the power. You have the power how you control how you react to the outward stimulus. It's a very two liners, but very deep.
It is. No, it is. It is very deep. And this isn't to dismiss your feelings, right? Like if you're
Yes,
angry, frustrated, sit with it. Like what is it telling you? Maybe, but
exactly.
do something about it. Like talk to somebody about it. Maybe you're like, I think I need to process this. I need to just get it out of my
Yes,
system.
yes,
Beating yourself up over it, I don't think you're going to get very far because you're not going to. People usually don't ask themselves like really great questions. They repeat things as like you're in a mirror maze. It's not
mm,
helpful.
right. So now let's take up a second example question. Can the
Mm?
mental state of the veterinarians cause an impact on the health as well as the psychology of animal?
That's so interesting. I so I don't know much about animal psychology. I
All
have
right.
only I had a pet, like I had a dog for a long time. I've had a few dogs actually.
Oh,
Um, and if I've ever been crying or in pain, my dog has sensed that and has come close to me. Um, I feel like I can tell when my dog is happy, when the dog is content. So they feel, they communicate. We read things on their facial expression,
fish.
although sometimes maybe they have like two or three modes. So
Yes,
it's not actually that. We project a lot. We're like, oh, I think they're very happy, and you're like, okay,
exactly.
this is one of their three faces they do. Um, but I would say that I think as a doctor, as a veterinarian, when you're anxious, you're experiencing compassion fatigue, remember that your patient is the animal, and the animal will almost always give you the benefit of the doubt. And an animal is
Okay.
usually quite generous in their interpretation. The person they came in with, less so. Because the
Yes,
person who came
exactly.
in with them is reading all kinds of signs. So remember, you're thinking about two people in the room. And I think warmth, connection, love, I think animals can read that and they can appreciate it. I also personally think, uh, animals are like such a beautiful source
Okay.
of love for humans that we owe it to them to be kind in return. Actually,
Exactly. Indeed.
there's nobody's come in, and I've
100%.
never heard anybody say my dog treated me badly when I was a child. Like it's
Yeah, 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 exactly. You never hear this from any person, be it a dog person or cat person. They never complain like this.
your animals give you unconditional love,
I
and
love,
so it's
yes,
important to not take out your anger on them, to say like, this is the reason I'm here. In fact, the innocence and the helplessness of the animal is a moment to say to yourself, like, to reconnect with your purpose, actually.
exactly. All right. Okay. The next question we have is something every veterinarian goes through in their life. How to
Mm,
overcome stress encountered from animals' death.
yeah. Well, now there's a couple of things coming to mind. So we're talking about grief and loss. We're also talking about the sadness of end of life care, sudden death, and um, guilt, shame, and self blame that sometimes comes depending on what the cause of death was, right?
Okay.
So, in all cases, we're talking about grief, but the experience, the expression of grief is going to be different, right? So, similar to humans, if somebody is dying of old age, natural causes, you might say, this is really sad, but what a beautiful life that this animal had or this person had, or they were happy when they went. We often think about that, like, what are the conditions at the end of life? How good was the life, right? And so
Okay.
it's sad, but it brings us some kind of comfort.
Exactly.
Um,
Right.
I think people's personal beliefs also will have an impact, So I don't know if you believe in an afterlife and if that translates to animals. I don't know how people think about
Okay.
that.
Okay.
Um, but thinking about how good somebody's life is a frequent way that people talk about even humans.
Immense. Right.
Um, I think when an animal dies young because of
Mm-hmm.
health issues, that's really traumatic.
It is.
When an animal dies of sudden causes, that's like hit by a car or something, that's also quite traumatic. If an animal gets ill, so if in each of those cases, by the time the animal gets to you, there's very little you can do. And then you're working with the person to make a decision to say, does it make sense to keep this animal going? Um, and I think in that case, we usually think about the best interest of the animal and like minimizing suffering. And in fact, correct me if I'm wrong, I think it's a bit easier with an animal than with a human, you know? Because humans have so many complicated ideas about, like in human health, some people think keep this person alive at all costs,
Okay.
and other people will say no, end the suffering. So it really, there's a lot of guilt that comes with that decision making. I feel like
Same.
you want to say,
Uh,
go ahead.
Same thing goes in veterinary medicine as well.
Ah,
There
okay.
are a lot, yeah, there are a lot of pet parents or someone who have adopted a stray. They try to, like, even the veterinarians have suggested, because of the critical illness, because they know the prognosis is very grave, that animal will not recover, even though it has all both the points. He let that guy, let that dog, let that cat live a little bit longer, but on the other hand, that animal is suffering. So you are in a big dilemma. What is right, what is wrong? Both the things
Yes.
are right. On from everyone's point of view, both the things are right. So it becomes a more difficult thing for the veterinarian too. Like, I am from a medical thing. It is painful, and be it animal or human, pain is always causing a lot of issues, mental distress as well as physical. So it's a big
Yeah.
dilemma, even in veterinary medicine.
Okay. Okay.
Yeah.
I will say then, like, the thing we can take comfort in is having good communication with the person that brings the animal in, right? Which is
Okay.
similar to human loss, like conversation with the family, the caregivers, making sure everybody's on the same page,
Page.
making sure everybody understands. Because you have a quick, the vet is gonna have a quick way of understanding the prognosis, the long term outcome. Well, those are the same thing, but prognosis and what the course of action is.
Okay.
But to get somebody else on the same page takes a bit of work. And I think we can take comfort in knowing that, like the other, everyone who was on the same page, we all agreed that we had to make this decision.
Okay.
One thing that I want to highlight that's part of grief that often gets missed is anger. It's very normal when you're feeling sad, when you experience loss. So grief is our response to loss.
Okay.
And people will often think, oh, the anger, I don't experience anger. But their assumption is that the anger is going to be connected to the loss directly. So they'll think, I'm angry that the animal died. I'm angry that the person died. And it's possible that's where your anger could be. But often, anger is directed at the self. Anger is directed at the medical professional. So you're thinking, okay, I'm the target, I'm holding it. Sometimes anger is directed at a system. You might say, I'm angry with the state of healthcare. I'm angry with injustice. I'm angry with
Mm,
bad government policies. Other times, you don't know what, you don't have a target for your anger, but you just experience it because
okay.
anger can sometimes be safer than sadness.
Miss.
And so you will find that there isn't a lot of safe places for you as a vet to express your anger. But the safe
Okay.
target might be somebody at home. So you might get angry about something at home with kids, family, whatever it is. And that's an important recognition that when I'm angry at home, it's actually not about my partner, it's not about my kids. I think I'm angry because it's what we call displacement. It's a defense mechanism, but you displace anger to a target that feels safer, someone who can hold it,
Okay.
right? So you think about your family home as a container or even a close friend, if you're single or like you live with friends, whatever the safe container is, that's where the anger is going to come out. That's where you're going to displace it because it doesn't
Okay.
feel appropriate to express
Yeah,
it
you
somewhere else.
don't. Yeah, you don't go out to become angry on everyone.
No. So recognizing that anger has a role. And I think sometimes people think, as a professional, I shouldn't be angry or I can't experience anger. No, you're a human, you will experience
Yeah.
anger. If you've experienced loss, what follows is bereavement and grief. In those experiences, you will feel anger. Just look for it. I think that's the important part. Look for it because what your anger needs is a witness and compassion. And then it'll extinguish and it'll turn into sadness.
Right.
Yeah.
Uh, what I got from this, the what you answered, is that grief and from whatever deaths we encounter, grief channelizes into an outward manifestation which comes out as
Mhm.
anger. Now,
Yes.
eh, now how I, as an individual who's working 24/7, who is up learning skills, evolving with the technology, how I can, on a very individual level, channelize this anger and reduce this grief. Because if I am addressing anger, I also have to address the grief, right? How I can reduce this thing, how I can cope, I will not say cope, how I can treat this thing on on a very individual thing, because there are a lot of
Yeah.
mental health specialists like the lady Ativan we have here. So how on a how on a very individual level I can deal with grief and
Yes.
anger.
That- That's a great question. So, two approaches are coming up for me, right? One is from a cognitive behavioral therapy perspective, I would say, I'm feeling the anger. What are my thoughts? My thoughts might be, I failed the patient. Or my thoughts might be, things are unfair. So I take the thought and I think, what's more balanced, right? And
Okay.
when I think what's balanced, it's not positive. So if I say the world is unfair, I might say it's true, and that's why I need to continue to be compassionate. Or what happened to this animal was not a desired outcome, and I need to be able to accept the
Okay.
sadness because that is part of my capacity to love, right? Our capacity to love is on a continuum. It's in the same spectrum as our capacity to feel sadness and grief. So if you
All right.
feel something really heavy, you might remind yourself that, oh, I'm grieving hard. Well, that also means I have a big capacity to love. That's a beautiful thing. From an emotion focused therapy perspective, we might say, okay, you're feeling the anger. What do you think underneath the anger are some of the other emotions? Think about it as an
Okay.
iceberg. So, what are the other emotions? Because anger is very primary. You might say sadness, frustration,
Shin.
uncertainty. And then I might say, okay,
Feeling
now
dejected.
feeling deject. Yes. So then I would say, when you have that feeling, what is an underlying unmet need that you have,
Okay.
right? And so if you were to try to answer it, you might say to be heard, to be reassured, uh, to be hugged. you know, uh, and you can use this skill in any context. There was once where somebody told me they were anxious, they had a lot of deadlines, and they had a bit of cocaine in their home. And they were like, they went and they found it and they did a little bit. And I said, okay,
Okay.
great, great.
Not
You made a choice.
recommended at all.
No, not recommended. Also, it's not helpful for anxiety. But anyway, but I
Yes.
said to him, I said, okay,
Hmm.
I'm not judging you for this. Like, you looked
Yeah.
around. The way I'm seeing it is you were scrambling, looking for something external to soothe you.
Okay.
Did it soothe you? And he said, no, it made me more
Hmm.
anxious. I said, okay, you live, you learn, right? What's the underlying need? Is it soothing? And he said, no, it was reassurance. I needed to be reassured that, like, I'm going to get through things. Or, and I said, when you look for something external like that, I think there's another need there. He's like, yeah, just like, I think I was just looking for like reassurance or like a cheerleader, somebody to just witness my pain
Yeah,
or like
you
to be
can.
there.
Yes.
And I was like, how else could that be accomplished? He was like, I could hug my dog. I could call a friend. I was like, you know
Exactly.
what? Those are great. You really could get, like, in a way, if you think about what the need is and what it feels like in your body, and then you say, how can I get this need met? You can think about other things.
Obviously.
So
100%.
I, there's a number of ways to think about it. I think what's really important is not to judge yourself for feeling grief and for feeling the anger, which is part of grief, right? And I think for a lot of people, when we recognize the anger, whether it's in the moment or it's displaced onto a safer target, when we can recognize it, then we can have compassion for ourselves. When we can recognize it, then it gets extinguished and we can sit with the sadness.
Okay. If this is not addressed, then it will lead to compassion fatigue.
It'll lead to compassion fatigue, and you'll take your anger out. Like, the person at home who you live with doesn't know that you're displacing your anger. So if they don't know that that's happening as a defense mechanism.
Mm,
So if it happens all the time, it'll ruin your relationships because you'll take your anger out on other people and you'll push them
people.
away.
Okay.
Right? So be careful.
You need to address the grief and anger
Yes.
before you ruin your personal and professional life.
Yes.
Okay. Okay. Now the next question we have: how to handle intense work pressure? Be it veterinary
Yeah.
medicine, healthcare, physician,
Mm.
IT professionals, psychiatrist, everyone have this issue. Work
Yes.
pressure.
So on a broad scale, so two things come up for me. One is internal resources, and
Okay.
two is a self care practice. So I'll talk about each of these. When people talk about self care, they often talk about things that they do outside of work.
Okay.
So that could be useful, but I think it's so important to talk about what it means in your work. So the question I want to ask myself is, what do I need to do in my work day, in my work week, that supports me and prevents resentment or frustration. So sometimes that's planning professional development. For example, I like to go to conferences. And when I plan those, I tell myself, you're going to meet other people, you're going to learn, it's going to be fun, and you don't have to feel guilty about spending the money to do that. That's part of your self care, right? And it gives you something to look forward to if you enjoy it. So you can see that, somebody might say you're treating professional development like a vacation. And I'm thinking, no, no, it's a legitimate part of my work, and it's a way to feed myself.
Okay.
Another thing is your work hours. I think
Okay.
blocking off time for administrative tasks or finding ways to make administration easier. So if you feel like you're coming up against something regularly, sometimes it's a skill you have to build. Other times you need a template, for
Right.
administration. Like,
Obviously.
so when I worked at a health center, I loved that the templates in the medical record chart were very helpful. So think about ways to streamline your work. With animals, you don't have to worry as much about confidentiality. Maybe there's an AI tool you can use that helps you streamline the admin tasks.
Okay.
Scheduling, usually people will walk in or they'll schedule with a medical secretary or a reception or, see if there's a way to, if you do back to back appointments, to make sure you block off 15 minutes between some appointments, or make sure you block off a lunch. That's very important. And you have to treat it in a way where you say, I'm just not available at that time. It's as though I'm not here, right? And when people do things like take breaks for lunch, I think we have to bring in some of the tools of mindfulness or based stress reduction, where we're really thinking about what we're eating. We intentionally planned a meal, or if you eat out,
Okay.
whatever, but you're present and you're not
Okay.
reading stressful news, or you're doing something nice. You're like, it's an intentional break.
Okay.
Another
Something
thing,
which
go
something
ahead.
you are doing consciously and which unfold your brain. It should not
Yes,
put pressure on your
exactly.
brain.
And the other thing I would say is, in the context of work, is if you have patients that are challenging
Okay.
and they're rebooking with you, they're not coming in for an emergency, you can suggest when they come in. So for me, as working in mental health, people who are very challenging, I never want to see them on a Friday afternoon. It's just not what I want to deal with.
Okay.
I want to see them early in the week. And so
Get done
you
with it, huh?
decide when is the best time, and yeah, I get that. And also, then you feel better about the rest of the week. And you don't have to tell them
Yes.
this, right? But it's part of self care where you're thinking, you know, I noticed you've come in with multiple concerns, and I find my Monday mornings are less busy. Can I schedule you in for a follow up then? So that's how I would say it. I don't know how you would say it, if it's a possibility or not. But I think when someone's coming in for a follow up, you have an opportunity to schedule them in a way that feels good for you.
Okay.
Um, so those are some external things with the environment. I think, earlier I was talking about reducing isolation for people through medical rounds or team consultations. I think doing team retreats or team half learning days can be very useful, where you bring
Okay.
somebody in and you all do professional development, but as you do it, you have an opportunity
Okay.
to do some team building. You want a sense of morale. You want people to feel good about coming to work, and I think it's worth the time. I did a training with an organization last year, and they work in a very intense environment. And one of the people in the training said, because I'm here and I recognize the value of being here, I'm not at the emergency site where I'm needed so people could die because I'm not there. And I said, this is a problem. This is a problem that your work has made you feel this way. It's a problem that you think if you're not there, the world is going to collapse. Like the way this has been framed is not good. It's leading you to a very dark place. I can tell you right now.
Okay.
um,
Amazing.
you know what I mean? So we have to be able
Got
to,
it.
yeah, okay. And the last thing I would say is internally, we're going to have pressure. We're going to experience pressure from people, from our animals, from the urgency of a situation. Anyone who does yoga, do you do yoga, Dr. Ghazi?
Yeah, yeah. Yes, yes, I do. I
Yeah.
used to, but it's been a
They,
long time. I have not practiced yoga.
sure,
So yeah, but
but
yeah, I know.
you can appreciate the way they talk about using your breath to create
Breath.
space.
Yes, exactly.
And they say funny things like breathe into your back, or when you are in an uncomfortable pose, they'll say breathe into your leg muscles or something like that, which
Yes,
usually it's
yes.
not, it doesn't compute.
Make any
But to
sense?
me, yeah, but when you think about it, it's very useful to think that I'm in a state of discomfort
Okay.
and breathing into
Mm-hmm.
that space is about creating a spaciousness to think.
All right.
And so for me, I find that a very helpful way to say, okay, in any urgent situation, you could be a surgeon, you can be working in emerge, but I have to create the space. And through breathing and grounding, I need the space to think so I can make good decisions, right? And
Okay.
so that's a practice we need to have within ourselves to block out other people to say, okay, I'm going to take a moment to connect with myself, connect with my breath, create space to think, and then I'll make the decisions.
Okay. As we are talking about breathing, I have this question. I heard this on Andrew Huberman's podcast. Like, if
Yes.
we are feeling anxious, you
Yeah.
inhale, take a pause, and exhale. You do this thrice, and then do this for 1 minute when you are feeling anxious. Your anxiety levels will come down. Does this work, or is it something true?
Yes, yes. So if we're talking about, because anxiety has physical symptoms, not always, but
Yes.
often it does, one of the most common ones is shallow breathing. So when you do a breathing exercise, you're grounding yourself and you're getting control of your breathing, right? And so if you do like in for 4, out for 8, you don't
For
have to
100.
count. But if you do, you'll notice that you can see the intent is very much to regain a flow.
Okay.
So for treating symptoms, that's very helpful. It's good. And in the moment, it's very useful. However, if you're an anxious person or the anxiety is chronic or keeps coming up, you might need to address the underlying beliefs or negative
Issues.
thoughts or something
Exactly.
about the environment, right? So it's a balance between the individual and also the environment,
And when
yeah. And sometimes you might say, this is a helpful technique, but it's that person who drives me crazy. They make me feel inadequate. And so that's okay. I think that's when you need to talk to someone. You say like, that this is the person's personality. And
yeah.
and in primary care, sometimes we'll say, okay, that person, maybe we'll have a doctor and a nurse in the room,
Been
and one
there,
person
done
talks
that.
to the difficult person and the other person will focus on the patient, because it's two people are all two things. People are all well intentioned and they're trying to survive,
Okay.
right? But also they can make it difficult for you to do your job while they're well intentioned and trying to survive. And so sometimes you need help to attend to their needs so that you can do the job you have to do.
All right.
You know?
Okay. Got it. I exactly, I know, I totally relate with this thing. So now let's move forward. Does journaling and affirmation help?
This is a good question. So I think journaling can help. I haven't done it personally, but it's difficult because people will often have a lot of judgment and they'll say, I don't know what to write. So if
Okay.
you're a creative person or you have a creative side to you, you can appreciate that it's just about allowing yourself to write a certain amount about whatever's coming to you, about the day, the feelings, etc. If you have trouble with it and it's a practice you want to get into, you might start slower. You might say, I want to have a few prompts, right?
Okay.
And the things I want to comment on are how I'm feeling, how I felt I did today, uh, which interactions went well, right? So for some people that I work with, one thing they struggle with is, am I good enough? Or am I, they're struggling with imposter syndrome. And so they might say, if I ask for help or, people are judging me. So I'll say, why don't we create 3 prompts?
Okay.
Interactions, when I asked for help, any judgments I received. So it gives people a more accurate view. And I would say just do the prompts every day and that's enough. So journaling can be good. It depends on the goal. You see, like
Okay.
you can structure it in a way that it's more intentional. You can also say it's about just getting things out. Affirmations can be good, but I'm hesitant because
Okay.
I think affirmations sometimes contribute to what people call toxic positivity because affirmations tend to be these global statements like I am a good person. Yeah, I'm sure you are.
Okay.
Or like everything will work out in the end, or everything will work out the way it's meant to. Those could be helpful on a personal level, but if you try to say them to somebody else, they could feel very irritating because they could feel
Okay.
dismissive. Um, I think when people who are have like social privilege use affirmations with people who are more disadvantaged, it feels infuriating. So if somebody is a wealthy person, somebody's a white person, and they're like, everything happens for a reason, and you're like, I find that so
Mm,
infuriating because this person's struggling with
yeah.
poverty. Like, no,
Got I
that's like
understand.
so
Yeah.
upsetting. So as long as it's very individual, sure. Because I do cognitive behavioral therapy, we talk about the automatic unhelpful thought and we think about coming up with a realistic balanced alternative. And so that's different than an affirmation, right? So if an affirmation is like you know, I'm a good person or I'm loved, right? The balanced thought in a particular situation is more likely to be like something more nuanced, like not I'm loved, but I have love in my life and I'm
Okay.
working on accepting that this person is upset with me. That's a
Huge
balanced thought.
difference. Huge difference in
Yeah.
both.
And there's a nuance, right? Or also like instead of everything happens for a reason, you might say, I'm enduring a significant loss. In time, I might find meaning in this experience. That's much more reasonable.
Okay.
Trying to, especially after somebody dies, to say things happen for a reason is so, it's so obnoxious. you know,
Exactly.
if you're driven to find a meaning in something like that, you might say, at the moment, I'm feeling a lot of loss and I feel angry, and maybe I'm open to finding meaning in this later. Great. Mashallah. Good.
Yes.
So balanced, alternative, nuanced thoughts, I think, are more helpful. The other ones that are affirmations, they're good individually. If they resonate with you,
Okay.
please don't share your affirmations with other people. It's very irritating.
For me, affirmations are like you are telling I'm the best, I'll do this something, and you are laying in the bed and you are not putting the efforts. For me, affirmations are not my thing.
No. And okay, and I know you've seen my Instagram, and I've been talking about narcissism recently. So the
Yes.
way affirmations can come off, if you share it with somebody else as a kind of
Okay.
gospel, even if you share your own religious way of thinking with somebody else as one way of thinking, it can be a kind of what's called like spiritual bypassing or spiritual narcissism, where you're kind of telling somebody that nothing affects you because of the belief you have. And so if somebody else could be stronger in their faith or could believe things in the way you do, they won't have a problem. This is
This is
stupid.
something I would love to know more of, because I've started reading religion as a theology. We humans have our faith, our thought processes, our biases towards things, right? So I've started,
Yes.
especially with religion, it's a hot topic. So I've started to keep my biases on the side, and I've started to read religion from a scientific point of view. Like it
Yeah.
talks a bit.
We're talking about addiction and food, right? So I was saying
Yes.
that some people like the language of addiction. It really helps them describe a behavioral pattern where there's like craving, loss of control,
Okay.
continued behavior despite consequences. Other people don't love that because addiction can sometimes sound like us. It gives you a sense of like something's innately wrong with you, like biologically, genetically. It also
Okay.
can sound like something's very static. So once you're an addict, always an addict, right? Whereas some people will say, I used to have a difficult relationship with alcohol, and now my relationship with alcohol
Okay.
has changed. So I just
Hmm.
want to introduce that nuance when it comes to food. Um, you know, you know, in the DSM, we do have like binge eating disorder.
Yes.
And
Yes.
so, in a sense, I would say, yeah, you could have an addiction. I think what's more useful is to ask yourself or to frame it as self soothing behavior. To say,
Okay.
when do you feel like you're eating because you're hungry? And when do you feel like you're eating to soothe a stressor? Right? Like, let's create a distinction. And what kinds of foods do you choose um, to soothe yourself, right?
Okay.
And then we have to say, is it a problem or is it not a problem? It's not always. Some people are stress eaters, but they never go diagnosed or labeled improperly. Sorry, they never get labeled as having a disorder because of their body size.
Okay.
So I'm conscientious of this because we live in a very
Hmm.
fat phobic society that equates health with thinness. So
Okay.
I just want to put out that anyone can have a difficult relationship with food, um, regardless of your body size, right? There's people who are fat who are very
Sure.
healthy or who have a very intuitive sense of eating. People who are thin who eat lots of junk food, stress eat, poor diet, all of that. Another thing I want to bring up with
Okay.
food is that um, the relationship can be informed by trauma, right? So some people who eat, when you like to soothe, you might say like, do you feel like you overeat, right? So how full are you? How hungry are you before you eat? 1 to 10. How full are you after you eat, right? And some people will say, I was satiated at a
Okay.
particular point and then I kept going. And so you want to create a bit of understanding, like
Hmm.
what is that about? And for some people, they'll say, when I was younger, you know, if I didn't eat
Okay.
everything on my plate, I was punished or I was guilted. Or they'll say, I grew up in
Okay.
poverty. There were sometimes we had a feast and other times we had nothing.
Hmm.
And so
Okay.
you want to create insight about what it means to the person and how does the past inform the present, and try to create a story about how the present is perhaps different than the past, right? You can tell yourself
Okay.
things like this is not a scarce resource for me now. I don't have to treat it like that, right? Or
Okay.
if overeating becomes a pro or eating for self-soothing becomes a problem, you might say, this is one of my self-soothing tools.
Mm-hmm.
I can also add another one to the
Okay.
toolbox.
All right.
I'm very careful. I don't want to
Okay.
punish people around food because I think food is so sensitive.
Okay. All right. Got it. So, as we are heading towards the end, any suggestions you would like to give to the amazing vets who are working out there, looking after animals, despite putting their mental health at stake?
Yes, well, I would just say you're doing amazing work.
Thank
And
you. Thank you.
I hope you don't feel underappreciated because you're very appreciated. But also, um, please continue to think about your own mental health. Because if you think about it, the physicians, the vets they're seen as being at the head of the clinics. And so if you're more engaged with your
Yes.
own mental health, people around you will appreciate that and their perspectives will shift. And so I hope that this talk is helpful, and I hope that you continue on your
And
own mental
it
health journey.
is. Thank you so much for giving your time, for your sharing the experiences, addressing mental health issues both in students and exploring other entities. So thank you very much. That was Rahim Tahir, Lady Advent. Ladies and gentlemen, thank you for your interest in veterinary medicine. Signing off now.